So, welcome to Semi-Critic. So, previously we have discussed with the biomaterial based on host response and the history of the evolution of biomaterials from past to present. Now we will discuss about the origin of defect in the body. So, defect are classified with life quality and tissue degradation due to aging. So come to the life quality part. So those are the part like basic disease what we are going through day to day life, like arthritis is the main cause of orthopedic diseases, knee pain and other things. Other detrimental things are the sudden accidental developmental defect, and sometimes we are going through of going for implant because of only aesthetic reason. So this is basically for aesthetic reason we are going through like skin grafting, oral implant. So these all. Now comes to the tissue degradation due to aging. So with aging the problem will occur such as wear of the joint, heart failure and osteoporosis. Now, this is the basic uh, problem with the age, or maybe after 50 or 60. So those are much more common. Tissue degradation technique. Now come to the goals. So we have discussed the problem. So problem behind the use of biomaterials. Now we are comes to the problem. Now we are coming to the solution or why we need biomaterials. So assisting in means biomaterials are basically used for support, replacement and support, replacement and repairing. So here I have basically write it in 3R and 1 S. So first is regeneration, repairing, replacement and as well as supporting. So bio inert biomaterials are basically used in this zone. So repairing and regenerating we are basically going through the bioactive biomaterials. And for replacing part we are basically going through which have more mechanical strength. And otherwise means others wise we are used as a sometime we are used as a aesthetic purpose such as oral implant. Next we will broadly classify the biomaterials based on the problem area. So replacing of disease or damage part. So basically replacing and damage part we are basically going through the high mechanical strength biomaterials such as artificial hip joint. During artificial hip joint we are using this kind of load bearing application based biomaterials. Other problem areas are like assist in healing. So for assist in healing we are using bone plates, screws, etc. For improving our function of the body or function of the other body parts. So sometimes in accident we are we our hand and legs are broken. So to improve the function of that broken part, so we use this kind of implant. Or sometimes we are getting so basically this is what I have mentioned for accidental damage. So so the biomaterials like orthopedic implant, orthopedic based implant, orthopedic implant. Others implant are sometimes we maybe lose our eyes. So this kind of cochlear implant we are use or intraocular lenses we are use. And sometimes cardiac arrest are taking place mm, suddenly. So pacemaker are used also. So the cage of pacemaker is very important uh, as it is placed near to the heart. So that consideration of biomaterials is very much important. And correct functional abnormality, so such as cardiac pacemaker, same things like the heart SA node will not work properly, so we will go for pacemaker. Correct cosmetic problem, so basically we are using soft tissue augmentation and chin augmentation. Next, going for diagnosis, so we are using catheter and probes. Okay, basically micro probes are used and catheter also used. And based on treatment, some drains are used or catheters are used. So this is the problem area we have identified so far. So we will improve that problem area using this kind of biomaterials. Now comes to the now comes to the like what I have discussed, like for cochlear, dental, shoulder, cardiovascular, prosthesis, acetabulum, bone fixation and knee prosthesis. So these are the zones where we have largely use biomaterials as a supporting or replacing or added with to functionalize the organ properly. So now comes to the application of biomaterial respect to the different part of the body. So different part of the body basically needs different mechanical strength, different uh, structural morphology, different tissue characterization, different uh, different kind of elasticity as well. So some are linearly elastic, some are um, some are linearly elastic, some are uh, not linearly elastic as well. So based on these different zones of our body, so we have used for ocular purpose silicon or acrylic based polymer biomaterials, some ear silicon based also. Dental we are basically going through SS, cobalt, chromium, modelium, alumina, hydroxyapatite base. Degradable structure polymer we have used this kind of thing like PLA, PGA, PCL, this kind of. For spinal cord, cobalt, chromium, molybdenum, ultra high molecular weight polyethylene. So this kind of. And this is the brief description about for which part based on the their characterization based on mechanical as well as chemical as well as physical, we have used different kind of biomaterials. So today, that's all for today. Next day we will describe how the generation of biomaterials comes into the picture. So that's all for today.